Good afternoon, and thank you, Emilia, for letting me to take the floor. And let me start by thanking UCLG, Metropolis, and UN Habitat for this excellent initiative that responds to a clear need for exchanging information, lessons learned, and experience among cities that are or will be touched by the coronavirus epidemics. Before presenting how things are going in Barcelona, let me highlight the added value of this community and that we have just listened to some of these representatives. So it's not so often that we can share this scenario with people representing UN representatives here, and the role of national, as we know, the role of national governments in this crisis is key, also in terms of supporting cities. The health crisis is a global crisis, but the impact of coronavirus and the measures taken by national governments are very much local. Social services, housing, mobility, sanitation, health, and even funeral services are, at least in Spain, as you know, on the hands of cities and regions. So it's great to have the UN listening here today. And let me start with the figures. In Barcelona, we are currently managing the emergency and trying to anticipate the needs. Just a clarification, those on the screen are yesterday's infection and death toll in Barcelona and Catalonia. This morning figures are much worse. We have 9,937 positive cases and 516 death people caused by the virus. While the epidemiological goal of the health measures taken by the Spanish government aims at flattening the transmission curve to avoid a collapsed health system, the truth is that we are still experiencing an exponential growth of both transmission and deaths. Following the state of emergency declared by the Spanish government, most of the people in Barcelona is confined and the activity in the city has declined. For instance, and I think the figures are very important, there has been a 90% reduction in subway and bus users and 60% reduction in car transit. Regarding the city council, we have instructed all civil servants to work from home, except those who are part of essential municipal services, mainly social services. If we talk about the main challenges in this context, we are, of course, encountering several challenges, but I would like to highlight three of them as probably the most relevant ones for the welfare of our citizens. The first challenge is ensuring the supply of personal protection equipment for health workers, as well as municipal workers that are part of the essential services that are not confined. We are lacking face masks, protective goggles, suits, and so on, as many of you have said. And while we are in touch with some Chinese counterparts that are willing to donate this sort of goods, national and international regulations do not ease the process for importing them. The second challenge that we are facing is ensuring a full guarantee of social services for vulnerable groups, homeless people, unaccompanied minors, elderly populations, and other groups. We are starting to struggle with ensuring food delivery to groups with limited mobility, for instance, and while do not foresee a major housing crisis, we do need to be prepared to support with rent payments or to provide mental health care in a context of confinement. Thirdly, we also need to enhance our intelligence and midterm assessment capacities so as to anticipate challenges that we may encounter in the coming days and weeks as the virus progresses in the city, and also to plan for the social and economic dimensions of the recovery and post-crisis phase. And let me make a step to the local responses, I would like to share 3 measures adopted in Barcelona. The first one, as part of our efforts to mitigate the impact of the crisis on our local economy and protect jobs, the city government has decided to keep all our contracts with municipal providers, regardless of whether they can provide the services they are being paid for. But this will be conditioned to the maintenance of jobs by the contracted companies. The second one, with our social action and beyond the measures to guarantee access to food and basic services for all populations, especially those most vulnerable, we have also set our sight on the socially isolated elderly populations. For that, we have expanded a municipal program that facilitates the interaction of elderly people living alone with their families through digital platforms. And we have also opened a new communication channel within this platform, especially dedicated to provide health support and monitoring for those populations. If you allow me, we are working on that physical distancing doesn't mean social distancing. And finally, we have also adopted a set of measures to guarantee everyone's access to an adequate housing at times when having a shelter is central to being safe from the epidemic. These actions range from successfully calling for the suspension of all evictions, as Leilani said, to setting a moratorium on municipal rents and reaching an agreement with touristic apartment operators to make available over 200 apartments to socially vulnerable families, among many others. And finally, if we talk about the future vision, let me say that in this context, for us, it is also important to start thinking about how to size some opportunities that, despite the crisis, still may arise, so that we get out of this crisis better prepared than before. Some of the takeaways of what we have done so far are the following. The first one, current social policy efforts show that we can take the city further in terms of provision of social services. To this, we need to find a way to ensure the sustainability of some of the efforts we are doing, from housing to food security and elderly population care. In this context, we are also witnessing the central role of digital services in keeping a certain level of social cohesion and economic activity in the city. This is why we need to make a clearer effort to place digitalization at the heart of our rights-based approach to municipal services. A third challenge for the coming months is how to include the private sector in an overall recovery efforts. We are working closely with social and civil society organizations, but we need to be able to include the private sector in the economic efforts that will be needed once the health crisis is over. And finally, and more generally, we will also need to learn how to capitalize on the new urban dynamics that we are witnessing these days regarding remote work or mobility patterns, for instance, which can produce healthy changes in our way of life and obviously can contribute also to combat climate change. Let me finish by thanking again the organizers of this meeting and letting you know that we have a document in English with the full set of measures adopted in Barcelona up until now, and that I will be happy to share it with you if needed, obviously.